students, welcome back. Now we are going to see acromioclavicular joint. This acromioclavicular joint is one of the components of the shoulder complex. In the previous videos, we have seen the sternoclavicular joint. Now we are going to see this acromioclavicular joint. Here you can see this acromioclavicular joint. So this acromioclavicular joint attaches the scapula. So this joint attaches the scapula to the clavicle. Acromion is a part of the scapula, that is the acromion process is attached to the lateral end of the clavicle. And this joint is described as a plain variety of synovial type of joint. It is a plain variety of synovial type of joint. Okay, now coming to this range of motion or available range in this acromioclavicular joint is 3 degrees of freedom is present at this joint also, and which consists of 3 rotational and 3 translational degrees of freedom. Okay, and this joint is having a joint capsule and also 2 major ligaments. It is having a joint capsule and 2 major ligaments which reinforce the joint, and sometimes it is having a disc inside. Articular disc is present, and it may present or may not be present. Okay, if present, this fibrocartilaginous articular disc which is present inside, that is dividing the joint incompletely into 2. It will not divide the joint into 2, but it will divide the joint incompletely if present. Okay, now, so what is the main and the primary function of this acromioclavicular joint is to maintain the relationship between the clavicle and the scapula in the early stages of elevation of the upper limb. Okay, and it also maintains the relationship between the clavicle and the scapula in the early stages of elevation of the upper limb, and it allows the scapula additional range of rotation. On the thorax in later stages of elevation. So in the early stages, this joint helps to maintain the relationship between the clavicle and the scapula, and in additional range of elevation of the upper limb, it allows the scapula an additional range of rotation on the thorax. So on the thorax, the scapula will be rotate in further ranges of elevation. Early stages, it maintains the contact between this clavicle and the scapula. Okay, and this acromioclavicular joint allow the scapula to rotate in 3 dimensions during arm movement, so that the upper extremity motion is increased. That means if scapula is not rotated, the full range of elevation is not possible. So this joint forms an axis for the scapular motions. Okay, and so normally the upper extremity motion is increased when the scapula rotates on the thorax, forming the axis at the acromioclavicular joint. In such conditions, the upper extremity motion is increased and the glenoid is positioned beneath the humeral head and the scapula is congruent and stable on the thorax. Okay, and this acromioclavicular joint also allows transmission of forces from the upper extremity to the clavicle. From the upper extremity to the clavicle. So this is about the acromioclavicular joint, its type and its structure and the type of ligaments which are present and the main and the major function of the acromioclavicular joint. Now we are going to see now this acromioclavicular articulating surfaces. Articular surfaces. The acromioclavicular joint consists of articulation between the lateral end of the clavicle. So this is the lateral end of the clavicle which is having a facet, small facet, and also another small facet on the acromion of the scapula. And these articular facets are considered to be incongruent. So these facets are also facet surfaces are also incongruent like sternoclavicular joint, and it vary in configuration. So the configuration of this articular surfaces are also varied. Sometimes the articular surfaces may be flat and sometimes one is concave and another one is convex. Okay, so in some cases, so one other surface is convex and another one is concave, like that. Some variations in the configuration of the articular facets can be seen in the acromioclavicular joint. Okay, so this variation, that is the vertical inclination, we can call it as the vertical inclination in between the articulating surfaces. In between for example, this is the articulating surfaces. So this is the vertical inclination of this articulating surfaces varies from individual to individual. So we have seen some people may have flat surfaces, okay, and some people may have concave convex surfaces, or some people will have convex concave type of surfaces are present. So this convex concave, how can you describe means, so for example, if you take this acromioclavicular joint, so if you take this clavicle and this acromion, if both the surfaces are flat, that is one type of variation. Next, acromioclavicular, on the acromion the facet is concave and in the clavicular it is convex, so then it is concavo-convex. And sometimes what will happen is again acromioclavicular, so this one becomes, that is the acromion becomes convex and this clavicle becomes concave. So such kind of variations are present from individual to individual. So here what will happen, the inclination, the vertical inclination of the joints will vary according to different types of configuration. Okay, That is the point they want to explain here. So one biomechanist that is called as his name is De Palma describe three joint types. So in this joint only he described three joint types in which the angle of inclination, so that is the vertical angle of inclination of the contacting surfaces. So in between the contacting surfaces, the angle of inclination varied between 16 degrees to 36 degrees. 16 degrees to 36 degrees. Okay, from vertical, this is the vertical inclination. And he suggested that the closer the surfaces, if these two surfaces are very much closer, then it is having flat surfaces. So if these two surfaces are very much near, then it is having flat surfaces. Such kind of flat surfaces are very much prone to wearing effects or wear and tear of shear forces. Wear and tear, that means it leads to more arthritic changes in flat type of configuration of joint surfaces. But in the case of acromioclavicular joint, so there is very less chances of these arthritic changes because of this joint configuration. So here the vertical inclination is varying from 16 to 36 degrees. So the vertical angle of inclination is not that much small in the case of acromioclavicular joints. Okay, now coming to the acromioclavicular disc. The disc of the acromioclavicular joint may vary in size if present. So articular disc is also a fibrocartilaginous, and the disc may be present inside or may not be. If present, this articular disc divides this joint incompletely. You can see this. So here this center part is the articular disc, but it is only present up to half of the joint. So this joint is divided incompletely into two, but not completely. Okay, so this also vary in size between individuals. Within an individual, as the based upon the age, and also in between the shoulders of the same individual. Okay, so this at the age of 2 years, this joint actually at the age of 2 years, these two have a fibrocartilaginous union. These two surfaces will have a fibrocartilaginous union with the use of upper extremity. So with the use of upper extremity, a joint space is developed, because so actually at the age of 2 years, these two surfaces are fused by fibrocartilaginous substance. But after that, with the use of upper extremity, a joint space is developed in between the two articulating surfaces, and these fibrocartilaginous structures may leave as a meniscoid, that is called as fibrocartilage. So meniscoid, fibrocartilage, which is the remnant of this fibrocartilaginous substance within the joint. So like that, this disc is formed. It is not an actual articulating disc. Okay, so this is about the acromioclavicular joint disc. Now coming to the acromioclavicular capsule and ligaments. Here in this pic you can see this capsule. This is the joint here, acromioclavicular joint, and it is covered by capsule and also acromioclavicular ligament at this part, and it is also having another important ligament is the coracoclavicular ligament. Okay, and this acromioclavicular capsule is weak in this joint to maintain the integrity of the joint. So to maintain the integrity of the joint, addition to the capsule, it requires another two ligaments, that is the acromioclavicular ligament and coracoclavicular ligament. So this acromioclavicular ligament assists the capsule. This ligament assists the capsule in opposing the articulate surfaces. So it helps in the assisting of the capsule. Okay, and this is the ligament which is present on the upper surface of the joint, and it is in quadrilateral in shape. It connects the upper parts of the lateral end of the clavicle and the adjoining upper part of the acromion. Okay, and the aponeurosis of the deltoid on this side and also the trapezius interlace with the fibers. That means some of the fibers will fuse with the acromioclavicular joint on the superior aspect, and such kind of ligament which is formed on the superior aspect of the joint is called as superior acromioclavicular joint. Okay, and this superior aspect of the, and also some fibers are also present on the inferior aspect of the acromioclavicular joint, which is called as inferior acromioclavicular joint. But out of these two ligaments, superior acromioclavicular ligament is one of the strongest ligament when compared to the inferior acromioclavicular ligament. Okay, the superior acromioclavicular is the main ligament limiting the movement causing by the anterior forces applied to the distal clavicle. So the forces which are acting anteriorly, commonly the deltoid muscles. Okay, deltoid muscle. So that is the most superficial muscle. Take for example, this one is a deltoid muscle. So the forces which are acting by this deltoid, so that is the anterior forces, for example, I have said. So the anterior forces which are applied onto the distal clavicle. So this ligament is limiting the anterior forces applied to the distal clavicle. Okay, the fibers of the I have already told that the superior portion of this ligament are fused with the trapezius and the deltoid muscle, making the superior joint more support and stronger than the inferior acromioclavicular ligament. Okay, so this is about the capsule and the acromioclavicular ligament. So the acromioclavicular joint is surrounded by the capsule, and this capsule is a fibrous sac which encloses the joint, and it is attached to the margins of the articular facet, and the joint cavity inside is lined by the synovial membrane. So this joint capsule is weak in the acromioclavicular joint, and the capsule itself can't maintain the integrity of the joint without taking the help from the ligaments. So the important ligaments of the acromioclavicular joint are this acromioclavicular ligament, which is of two types. One is the superior acromioclavicular ligament and inferior acromioclavicular ligament, and another ligament is the coracoclavicular ligament. So the superior acromioclavicular ligament, which is in quadrilateral in shape, which is present on the upper surface of the joint, which connects the upper part of the lateral aspect of the clavicle to the upper part of the lateral aspect of the acromion process. And on the upper surface, this superior acromioclavicular ligament fuses with some of the fibers of the deltoid as well as the trapezius, makes this superior acromioclavicular joint stronger than the ligament which is present in the inferior aspect. And this ligament helps in maintaining the integrity of the joint along with the joint capsule. And the main primary function of this acromioclavicular ligament is to limit the movement in the joint which are caused by the anterior forces applied to the distal clavicle. Okay, and this is about the acromioclavicular ligament. Now coming to the coracoclavicular ligament. So this coracoclavicular ligament. So this coracoclavicular ligament consists of two parts. One is the trapezoid part and the conoid part. And these two are united posteriorly. These two united posteriorly. The trapezoid part is horizontal. So here the trapezoid part is horizontal and stretches from the upper surface of the coracoid process. Stretches from the upper surface of the coracoid process to the trapezoid ridge on the under surface of the lateral end of the clavicle. So the trapezoid part is horizontal and stretches from the upper surface of the coracoid process to the trapezoid ridge on the under surface of the lateral end of the clavicle. And next one is the conoid part. This conoid part stretches from the root of the coracoid process. This is the root of the coracoid process to the conoid tubercle of the clavicle. Okay, between these two parts, it is having a bursa in between them, and the ligament is mainly responsible for suspending the weight of the scapula and the upper limb from the clavicle. This is the main function. And also, if you take, this is a combined function of this trapezoid and conoid parts of the coracoclavicular ligament. Now we will see the individual part, how this conoid part helps in maintaining the limiting this motions at the acromioclavicular joint. Now we will see here. So this is the horizontal portion called as trapezoid, and from the root of this conoid, the coracoid process, you will get the conoid part. This conoid part is somewhat triangular in shape, and a gap exists in between these two parts, and these two portions are separated by a bursa and some fat tissue called adipose tissue. And these two ligaments are present under the surface of the clavicle, and these two parts of the ligaments will influence the biomechanics of the shoulder. So how these parts or influencing the biomechanics of the shoulder, we can see in the integrated function of the shoulder complex. Okay. So although the acromioclavicular capsule and ligament can resist small rotatory and translatory motions which are occurred inside the joint, but the major large translations are limited by this coracoclavicular ligament. Though this coracoclavicular ligament doesn't have any direct attachment to this acromioclavicular joint, but it has a strong influence on this joint. Okay, now we'll see the individual part of this coracoclavicular ligament. Now coming to this conoid part of the coracoclavicular ligament provides the primary restraint, that means the limitation, primary restraint to translatory motion caused by superior directed forces. So on the top of the clavicle, which are acting on the distal end of the clavicle, that is superior directed forces. So, and these forces causes some translatory motion of the clavicle. That one is limited by this conoid portion of the coracoclavicular ligament. Now, this trapezoid part, coming to this trapezoid part, the trapezoid portion of this coracoclavicular ligament provides more than the conoid portion, to the translatory motion caused by the posterior directed. So this conoid portion limits the superiorly acting forces, whereas this trapezoid part, which is having more limiting function when forces which are acting on the posteriorly directed forces at the distal end of the clavicle. Because just think that, so this is placed horizontally. So whenever this horizontal, that means, so these fibers will act some forces which are acting on the posterior aspect. So this one is having some inclination for what? Conoid fibers. So it is making some angulation from root of the coracoid process to the undersurface of the clavicle. So it resists the superiorly acting forces, whereas this trapezoid, which is placed horizontally, so on the posterior aspect, so posteriorly directed forces are resisted by this horizontally placed trapezoid fibers. Got it? So these are the major functions of this conoid part of the coracoclavicular ligament and trapezoid part of the coracoclavicular ligament. So whatever the forces which are acting on the distal end of the clavicle is limited. The forces are limited by the superior acromioclavicular ligament and the coracoclavicular ligament. So this superior acromioclavicular ligament resisting the anteriorly acting forces. Got it? And conoid part of the coracoclavicular ligament is resisting the superiorly directed forces on the distal end of the clavicle. Whereas these horizontal fibers, that is the trapezoid fibers, are limiting the posteriorly directed forces on the distal end of the clavicle. So these are the functions of the ligaments which are present in the acromioclavicular joint. So such kind of functions you have to keep it in mind, then only you people can apply this thing when we are dealing with integrated functions of the shoulder joint. Okay. When medially directed forces, so we'll have this medially, so the medially will have this what humerus. So humerus. So medially acting forces. So what will happen? So some forces are acting on the medial side of the scapula. So this force causes some displacement of the scapula on the medial aspect. And this medial side displacement are also limited by this coracoclavicular ligament complex. So the medial side displacement of the scapula are also limited by this coracoclavicular ligament, which are caused by the medially acting forces. Okay. And these medial forces are also transmitted or transferred to the clavicle. So the medially getting forces. So from this it carries to the acromioclavicular joint and also through the clavicle, and finally it reaches to the strong sternoclavicular joint. So the forces are also transmitted to the sternoclavicular joint. So the forces which are coming from the medial side is also transmitted through the acromioclavicular joint to the clavicle, and finally it end up in the sternoclavicular joint. So one of the most critical role played by this coracoclavicular ligament in integrated shoulder function is to couple the posterior rotation of the scapula, posterior rotation of the clavicle to the scapular rotation during arm elevation. So the main function of this coracoclavicular ligament in integrated shoulder function is to couple the posterior rotation of the clavicle to the scapular rotation during arm elevation. So you have to remember this point. So this point we are going to use in the integrated function of the shoulder joint, which is very, very important. So with this we have finished the acromioclavicular joint structure and its acromioclavicular disc, its capsule and ligaments and their functions. In the next session we are going to see the acromioclavicular motions. Thank you.